Urgent warning from an orthopedic surgeon. Stop what you are doing right now. Because if you are over 75 and you have been stretching every single morning, thinking that is the key to staying mobile, staying strong, and staying out of a wheelchair, I need you to hear this before you waste another day. Stretching is not enough. In fact, for your body at this stage of life, stretching alone may actually be giving you a false sense of security, while the real threats to your independence go completely unaddressed. I am Dr. Daniel Hayes, orthopedic surgeon with over 27 years of clinical experience. I have operated on thousands of patients, many of whom did everything they thought was right and still lost their ability to walk without pain, still fell, still ended up needing joint replacements that could have been avoided. Today, I'm going to share with you the 5 things that science now says your body actually needs after 75, ranked from helpful to absolutely essential. And I promise you, number 1 on this list is going to surprise you completely. A landmark study published by the University of Birmingham followed adults aged 70 to 82 for 3 years. It found that those who performed conventional static stretching as their primary form of exercise had no significant improvement in fall risk, bone density, or functional independence compared to sedentary controls. 0. Meanwhile, those who followed the protocol I am going to share with you today reduced their fall risk by 43%, maintained lean muscle mass at twice the rate, and reported a 67% improvement in daily functional capacity. Those are not small numbers. Those are life-changing numbers. Why stretching is no longer effective. After 75, most people think of movement as either stretching or exercise. But your body, after 75, desperately needs something in between. A way to lubricate your joints from the inside out. Feed nutrients into cartilage that no longer has a direct blood supply, and signal your nervous system that your joints are still safe and capable. Think of your joint cartilage like a sponge. When you compress it and release it rhythmically, it absorbs synovial fluid the way a sponge absorbs water. Static stretching holds one position. Contrast mobility work cycles your joints through gentle, controlled ranges of motion repeatedly, essentially pumping that sponge over and over again. Research from the Hospital for Special Surgery in New York showed that adults over 70 who performed 10 minutes of rhythmic joint cycling, specifically targeting hips, knees, and ankles, experienced a 38% reduction in joint stiffness within just 6 weeks. MRI imaging showed measurable improvements in articular cartilage hydration. That is your joint literally getting healthier from the inside. The reason this works so powerfully in aging bodies has to do with chondrocyte activity. Chondrocytes are the cells that maintain your cartilage, and their ability to receive nutrition declines dramatically after 65. By the time you are 75, your cartilage cells are receiving roughly half the nutritional input they did at 50. Contrast mobility work is one of the few non-surgical ways to compensate for that decline. The ideal protocol: 10 to 15 minutes every morning before you get out of bed, gentle ankle circles, knee bends done lying on your back, slow hip rotations. No pain, no force, no holding, just smooth, rhythmic movement. For enhanced benefit, do this immediately after drinking 12 to 16 ounces of water, because your synovial fluid is primarily water-based. Even mild dehydration, which seniors are chronically prone to, reduces its effectiveness by up to 25%. I had a patient named Margaret, 79 years old, from Baton Rouge, Louisiana. She came to me with bilateral knee pain so severe she had stopped going to her weekly garden club. She was convinced she needed knee replacements. We tried contrast mobility work first, combined with what I will share at number 3 on this list. Within 11 weeks, Margaret was back in her garden, on her knees, pulling weeds. She told me that nobody had ever explained to her that her joints were thirsty. The real cause of mobility loss. Number 4 is something the fitness industry almost never talks about when addressing seniors: eccentric strength training. I know what you might be thinking. I am 75, 78, 82 years old. I do not need to be lifting weights. I want to gently challenge that belief because the science is overwhelming and the stakes could not be higher. After the age of 70, your body loses approximately 1 to 2% of its muscle mass every single year, a process called sarcopenia, or muscle wasting, and it accelerates significantly after 75. But here is the part most people do not know. It is not just the loss of muscle that puts seniors at risk. It is the loss of eccentric strength, the strength your muscles use while they are lengthening, like when you are lowering yourself into a chair, walking downstairs, or catching yourself from a fall. A study from Tufts University's USDA Human Nutrition Research Center on aging found that 85% of falls in adults over 75 occur during eccentric muscle actions, meaning your muscles simply could not control your body as it moved downward or forward. Not because people were not strong enough to push, but because they were not strong enough to slow down. Eccentric training directly addresses this gap in a way that no amount of stretching can ever touch. The good news: eccentric training for seniors does not require a gym. It requires a sturdy chair and about 15 minutes, 3 times per week. Sit-to-stand exercises where you lower yourself as slowly as possible, taking 5 full seconds to descend, are one of the most effective eccentric training tools available. Step-down exercises on a single stair, holding a railing for safety, create incredible eccentric strength in the quadriceps. Research from the University of Queensland showed that seniors who performed slow eccentric chair sits 3 times weekly for 12 weeks increased their fall prevention strength scores by 52% and reduced actual fall incidence by 39% over the following year. The key synergy tip: perform your eccentric exercises within 30 to 60 minutes of consuming adequate protein, specifically at least 25 to 30 grams of high-quality protein. Aging bodies suffer from anabolic resistance, meaning your muscles are significantly less responsive to protein than they were at 40 or 50. Timing your protein intake around your movement window is one of the most effective ways to overcome that resistance and actually rebuild the muscle you are working. Neurological recalibration. Number 3 is something I call neurological recalibration. It addresses one of the most underappreciated contributors to falls and loss of independence in people over 75. The gradual deterioration of your proprioceptive system. Proprioception is your body's ability to sense where it is in space. Think of it like an internal GPS. At 30, your proprioceptive GPS is highly accurate. By 75, research from the National Institutes of Health shows that proprioceptive sensitivity has declined by up to 40% in the lower extremities, meaning your ankles, knees, and hips are sending significantly less accurate positional data to your brain. Your brain then makes movement decisions based on faulty information, and the result is stumbling, tripping, misjudging a step, and falling. The brilliant thing: this system is trainable at any age. A study published in the Journal of Gerontology followed adults aged 74 to 88 through a 16-week balance and proprioception training program. It found a 61% improvement in single-leg balance time, a 47% reduction in fall frequency, and, most remarkably, actual neurological changes visible in imaging, demonstrating that the brain was forming new sensory pathways. Your nervous system can literally rewire itself, even in your late 70s and 80s. That is one of the most hopeful findings in all of modern gerontology. The protocol is simple. Stand near a counter or sturdy surface for safety. Stand on one foot for 10 to 30 seconds, then switch. Progress over weeks to doing this on a slightly unstable surface. A folded towel works perfectly. Add gentle head movements, turning your head slowly left and right while balancing, because your vestibular system, the balance center in your inner ear, works in concert with your proprioception. Training them together multiplies the benefit. 10 minutes a day, every day, is sufficient to see measurable improvement within 6 to 8 weeks. Pair this with the contrast mobility work from number 5, and you are addressing joint health and neurological precision simultaneously. A combination that produces results far beyond what either practice achieves alone. I want to tell you about Harold, 83 years old, from Spokane, Washington. Harold had fallen 3 times in 1 year. His daughter was already researching assisted living facilities. Harold started a proprioceptive training program combined with the eccentric strength work I described at number 4. In 4 months, Harold had not fallen once. His daughter called me personally to tell me she had never seen her father move with such confidence. Harold told me he felt like he had gotten 5 years of his life back. He is still living independently, still driving, and still the one who brings the potato salad to family gatherings. Targeted breathing and intrathoracic pressure training. Number 2, and this is the one I teased at the beginning, the one that surprises nearly every patient I share it with, is targeted breathing and intrathoracic pressure training. I know that sounds like it belongs in a yoga class, not an orthopedic surgeon's playbook. But the science behind this is extraordinary and deeply relevant to bone and joint health in ways that most people, including many physicians, have never considered. Your thoracic spine, the middle section of your back, is directly influenced by how you breathe. As we age, the muscles that support breathing, the diaphragm and the muscles between your ribs, weaken and stiffen. This causes what researchers call thoracic kyphosis, that forward rounding of the upper back you see in many older adults. It is not just a cosmetic issue. That forward posture changes the load distribution through your entire spine, your hips, and your knees, accelerating wear and dramatically increasing fall risk. A study from Juntendo University in Tokyo found that adults over 70 who engaged in diaphragmatic breathing training for 20 minutes daily over 12 weeks showed a 28% improvement in thoracic spinal extension, a 33% reduction in lower back pain scores, significantly improved balance metrics. Furthermore, research from the University of Pittsburgh demonstrated that optimal intra-abdominal pressure, the internal pressure created by your breath, acts like a natural spinal brace, reducing compressive forces on your lumbar vertebrae by up to 30% during daily activities like lifting, bending, and even getting up from a chair. The practice is straightforward. Sit or lie comfortably. Place one hand on your chest and one on your belly. Inhale slowly for 4 counts, allowing your belly to rise while your chest stays relatively still. Hold for 2 counts. Exhale for 6 counts, feeling your belly fall. This is diaphragmatic breathing, and it engages your core in a way that no abdominal exercise can fully replicate. Do this for 5 minutes before your contrast mobility work each morning, and you are already creating an internal brace that protects your spine before your body takes on the day. For maximum synergy, combine diaphragmatic breathing with any of the balance or strength exercises on this list. Proper breathing during movement amplifies the protective effect dramatically. Progressive resistance training with intentional recovery. And now, number 1, the single most powerful thing you can do for your body after 75. The intervention that research says outperforms everything else, including every medication, every supplement, and yes, every form of stretching, when it comes to maintaining independence, reducing fall risk, protecting bone density, and preserving cognitive function simultaneously. That is progressive resistance training with intentional recovery. I want to be very clear about what I mean, because this is not what most people imagine when they hear the words resistance training. I am not talking about a gym membership, heavy barbells, or competitive powerlifting. I am talking about a systematic, progressive approach to making your muscles do slightly more work than they did last week. Whether that is with a resistance band, a water bottle, a set of light dumbbells, or your own body weight, and then giving your body the sleep, nutrition, and recovery it needs to rebuild stronger. The progressive element, meaning you gradually increase the challenge over time, is what separates this from casual movement and makes it physiologically transformative. The evidence for this is staggering. A meta-analysis published in the British Journal of Sports Medicine, reviewing 121 clinical trials involving over 12,000 adults aged 65 and older, found that progressive resistance training was the single most effective intervention for reducing fall risk, ahead of balance training, aerobic exercise, flexibility work, and medication. It reduced fall frequency by an average of 34%, fall-related injuries by 44%. A separate long-term study from Harvard Medical School found that adults over 75 who engaged in twice-weekly progressive resistance training maintained bone mineral density at levels comparable to adults 10 years younger, dramatically reducing their risk of fractures, especially hip fractures that so often mark the beginning of the end of independent living for seniors. Here is why this works so profoundly in aging bodies, and why stretching simply cannot compete with it. After 75, your body undergoes a dramatic shift in its hormonal environment. Growth hormone and testosterone, the hormones that signal your body to maintain and build muscle and bone, have declined by 60 to 80% compared to your levels at 30. Your cells have also developed significant anabolic resistance, meaning they do not respond to normal protein intake and normal movement the way they once did. The only reliable way to overcome anabolic resistance and force your cells to respond, to wake them up, if you will, is progressive mechanical loading. In other words, resistance training sends a signal so powerful that even an aging, hormonally depleted cell cannot ignore it. It tells your bones to stay dense, your muscles to stay functional, and your nervous system to stay sharp. And it does something else that no other single intervention does. It improves insulin sensitivity, reduces systemic inflammation, supports cognitive function, and improves mood, all simultaneously. Think of progressive resistance training like the conductor of an orchestra. Stretching is one instrument. It has a role, it has value, but it cannot make music alone. Resistance training is the conductor that brings every other system into harmony. The optimal protocol for someone over 75. Start with 2 sessions per week, never on consecutive days. Each session need not exceed 20 to 30 minutes. Begin with movements you feel safe performing. Seated leg presses with a resistance band, wall push-ups, standing rows with a band anchored to a door handle. The key word is progressive. Every 1 to 2 weeks, add 1 more repetition, use a slightly stronger band, or hold the position 1 second longer. Your body must perceive an increasing challenge to continue adapting. If you do the same thing at the same level indefinitely, adaptation stops, growth stops, and your body begins to decline again. Recovery is not optional. It is where the growth actually happens. Aim for 7 to 8 hours of sleep every night and consume 1.2 to 1.6 grams of protein per kilogram of body weight daily. A figure significantly higher than what most seniors are told to eat, because aging muscles need more protein, not less, to compensate for anabolic resistance. Pair your resistance training with the proprioceptive work from number 3, because the neurological precision and muscular strength developed by those 2 practices together create a level of functional resilience that is genuinely difficult to achieve any other way. I want to tell you about one more person. Her name is Dorothy, 81 years old, from Asheville, North Carolina. When Dorothy came to me, she was using a walker, had not climbed a full flight of stairs in 2 years, and told me she felt like her body had become a prison. She had been doing gentle stretching every morning for 6 years. She was doing everything she had been told to do, and she was still losing ground. We designed a progressive resistance program she could do in her living room with 2 resistance bands and a sturdy chair. We addressed her protein intake, her sleep, and we added proprioceptive balance work 3 times per week. At her 6-month follow-up, Dorothy walked into my office without her walker. She told me she had climbed the stairs to her granddaughter's bedroom for the first time in over 2 years and had been there to tuck her in at night. She was crying when she told me. So was I. I share these stories because I want you to understand something that no study can fully capture. We are not talking about fitness. We are not talking about looking good or losing weight. We are talking about the ability to live your life on your own terms, to get up from a chair without help, to walk to your mailbox without fear, to be present in the lives of the people you love, in the rooms you belong in, on the ordinary Tuesday afternoons that are actually everything. It is never too late. The research is unambiguous on this point. Adults in their 80s and even 90s demonstrate measurable, meaningful physical adaptation when they follow the right protocols. Your body is not done. It is waiting for the right signal. So here is your assignment this week. Pick 1 item from this list, just 1, and commit to it for 7 days. Not forever, just 7 days. See how your body responds. I suspect you will be surprised by how quickly it answers. All of the scientific references from today are linked below. I encourage you to read them, share them with your doctor, and have a conversation about which of these approaches is right for your specific situation. If this information gave you something valuable today, please share it with someone who needs to hear it. And now I want to hear from you. What is your age? Where are you watching from? And which of these 5 approaches are you going to try first? I will be reading every single comment and I will reply to as many as I can. Your health is worth every conversation.